Welcome to This Explainer. Today, we're diving into the systemic ripple effect that happens when your body's master filtration engine starts to fail. You know, we so often think of our organs as working in total isolation, kind of doing their own thing. But as we're going to see, our internal systems are incredibly interconnected.
So, think about this for a second. Have you ever considered that your persistent itchy skin, or maybe those puffy eyes you wake up with, could actually be an early warning sign of a severe kidney problem? Honestly, most of us wouldn't. We usually just blame it on a bad night's sleep, shifting seasons, or maybe a mild allergy. But as we pull back the curtain on the medical data today, you'll see exactly why ignoring these subtle clues could be a really critical mistake.
Okay, let's set the stage by defining chronic kidney disease, or CKD. It's not just an isolated kidney issue. It's really an iceberg disease. Those visible symptoms above the surface, the stuff you actually see in the mirror, are just clues pointing to the massive internal damage happening way down below. When your kidneys lose their filtration power, it doesn't just hurt the kidneys themselves. It unleashes this cascade of toxins that touches virtually every single cell in your body.
Here is our roadmap for today. First, the silent kidney threat. 2, warning signs you can see. 3, diagnosing chronic kidney disease. 4, the blood connection, anemia. 5, the heart of the matter. And finally, prevention and early action.
Section 1. The silent kidney threat, systemic breakdown. To really get this, think of your kidneys like a car engine's oil filter. If that filter gets completely clogged up, the dirty oil just circulates right back through the engine, slowly destroying all those intricate internal mechanisms. Well, your body operates the exact same way. When your kidneys can't effectively remove excess fluids and metabolic waste, those toxins have nowhere to go. They accumulate in your bloodstream, literally flooding every other system in your body and throwing your biological engine into absolute chaos.
Section 2. Warning signs you can see. Clues in the mirror.
Now, you might brush these symptoms off as just allergies or maybe a weird skin thing, but swelling around your eyes or your ankles from fluid retention and persistent itching from severe toxin buildup, those are critical early red flags. Because the kidneys aren't filtering properly, waste products literally get trapped in your skin. It makes it intensely itchy, super dry, and can even change your skin color to a pale or yellowish tone. Your eyes might get red and irritated simply because toxins are circulating where they absolutely shouldn't be.
And this brings us to a huge distinction. There's a brilliant difference between just being tired and experiencing CKD-induced fatigue. Normal fatigue, a good night's sleep fixes that. But CKD fatigue is profound asthenia. We're talking about a total, debilitating lack of energy. Your body might literally be operating on just 20 to 50% kidney efficiency. And what's even worse, that fluid buildup and systemic chaos can trigger severe sleep apnea. So you're dealing with loud snoring, terrifying breathing pauses, and completely unrefreshing sleep, which obviously just compounds the exhaustion.
There are a few other subtle warnings that show the ripple effect is spreading even further. You might suddenly get this weird metallic taste in your mouth, or notice ammonia-like bad breath. That is literally the taste and smell of waste products in your blood that your kidneys failed to flush out. You might also feel some unexplained back pain near your kidneys, or experience sudden shortness of breath because fluid is actually backing up into your lungs. And of course, any changes in urination, especially foamy urine, which indicates protein leakage, are massive red flags you cannot ignore.
Section 3. Diagnosing chronic kidney disease, below the surface.
Let's look at how doctors actually figure this out. The KDIGO 2012 clinical definition shows us that CKD isn't just some temporary dip in function. It's officially diagnosed when structural or functional kidney abnormalities persist for more than 3 months. The diagnosis looks at the underlying cause, your glomerular filtration rate, and whether there's albumin, a type of protein, leaking into the urine. That 3-month marker is absolutely crucial, right? Because it's what distinguishes chronic, irreversible damage from just a temporary acute kidney injury. This clinical definition naturally maps out into 5 tragic stages based on that falling glomerular filtration rate, or GFR. Stage 1 starts off with seemingly normal filtration, but you'll see mild albumin leakage. As we progress down to stage 3, the GFR drops moderately. By stage 4, there is a severe decrease. And finally, we hit stage 5. This represents end-stage renal failure, where the GFR drops below 15 and the patient requires life support, whether that's in the form of dialysis or a full transplant. Section 4. The blood connection, anemia of CKD.
So, as kidney function plummets, how does this ripple effect strike the bloodstream? Well, it's a simple yet devastating chain reaction.
Normally, healthy kidneys produce a vital hormone called erythropoietin, or EPO, which essentially tells your bone marrow to make red blood cells. But broken kidneys, they make almost no EPO. At the exact same time, the chronic inflammation from the disease causes your liver to spike production of a hormone called hepcidin. Hepcidin literally locks away your iron stores so your body can't even use them. Add in a highly toxic uremic blood environment that causes your existing red blood cells to die much faster, and you are left with profound, debilitating anemia.
To fight this intense fatigue and dangerous blood shortage, modern medicine has to step in and basically do the kidney's job for it. Treatment relies heavily on ESAs, erythropoiesis-stimulating agents, and intravenous iron. By injecting these directly into the patient, doctors are effectively overriding that broken kidney engine. They're artificially stimulating red blood cell production, bypassing that hepcidin iron blockade, and finally giving the patient their energy and oxygen carrying capacity back.
Section 5. The heart of the matter. Cardiovascular impact.
I want you to let this number really sink in. 7%. Research clearly shows that for every 10 milliliter per minute drop in your GFR, which again is your kidney's filtration rate, your risk of suffering a stroke increases by a staggering 7%. And the exact same rule applies to heart attacks and heart failure. Basically, the worse the kidneys get, the harder the heart is hit.
The reason for this connection is that CKD acts as an extreme cardiovascular risk multiplier. Sure, you have your traditional threats, things like hypertension and diabetes, taking up about 30% of the risk. But then you add in these terrifying CKD-specific dangers. You've got uremic toxins causing massive chronic inflammation at 35%. You have overactivation of the body's pressure-regulating hormones, known as the RAS system, at 15%. And then, at 20%, you have vascular calcification. That is literally the hardening of your blood vessels into rigid pipes because of mineral imbalances caused by the failing kidneys. It is an absolute perfect storm for the heart.
Section 6. Prevention and early action. Slowing the progression.
Now, while the systemic damage is scary, empowering yourself means protecting the engine before the filter ever clogs. You absolutely must monitor and heavily control your blood pressure and your glucose levels, because those are the two biggest drivers of kidney damage. You also need to adjust your diet to take the workload off your kidneys. Cut the excess salt, scale back on unneeded protein, and drop the unhealthy fats. And fundamentally, you've got to stay hydrated to keep the blood flowing freely to those microscopic renal filters, while never skipping your routine blood work. As we wrap up this explainer, I want you to remember this. Early detection isn't just mildly helpful here. It is the absolute key to preventing the need for a dialysis machine or a kidney transplant down the road. If you can catch this in stage 1 or 2, you can literally slam the brakes on its progression. But you can only catch it if you're actually paying attention to the signs. So, the final question I want to leave you with today is this. Your kidneys are the silent guardians of your internal universe. The very next time you have persistently puffy eyes, a strange metallic taste in your mouth, or incredibly itchy skin for absolutely no clear reason, are you going to brush it off, or will you finally listen to what your engine filter is trying to tell you? Take care of your health, stay curious, and we'll see you in the next explainer.